4 of the worst San Francisco 49ers injuries of all time. Who got injured? How did it happen? What did it mean for them and the team afterwards? Stay tuned to find out. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your #1 source for information on orthopedic injuries and broken bones that's easy to understand for everybody. If you want to know more about my life as an orthopedic surgeon, be sure to follow me on Instagram or Twitter at Stable Knees. And I'm also on TikTok at Dr. Chris Raynor. And if you like these videos and you dig what I'm putting down, be sure to share these videos with someone that you know, because sharing is caring.
Okay.
So today we're talking about 4 of the worst injuries from the San Francisco 49ers of all time. And although there are a lot of injuries that may have occurred on the San Francisco 49ers over the past several decades, these are 4 of the most significant or interesting injuries that have occurred during that time period. So the first injury involves one of the most famous San Francisco 49ers quarterbacks of all time, Joe Montana. And this injury came from one of the most devastating losses of 49er history. And in this particular game, Joe Montana was injured during the 4th quarter of the NFC Championship game versus the Giants. And at the moment that Montana was injured, he was struck from behind with a brutal, and I do mean a brutal hit. While rolling out of the pocket, Montana was tackled from behind by a pursuing defender. He fell to the ground, fumbling the ball in the process. Montana remained on the ground for some period of time before being helped off of the field. And unfortunately, Montana was not able to return to the game. He ended up suffering a bruised sternum, bruised stomach, several cracked ribs, and a broken hand as a result of this tackle. Unfortunately for the 49ers, they lost this game, their season was ended, and that was the beginning of the end for Montana as a quarterback for the San Francisco 49ers. The next injury that I'm going to talk about involves a linebacker from the San Francisco 49ers, Navorro Bowman. Navorro was also injured during the NFC Championship game, this time in 2014 versus the Seattle Seahawks. And on this particular occasion, Navorro was injured during the 4th quarter of this game. On a 3rd and goal play, Jermaine Kersey attempted to score on a reception 3 yards outside of the end zone. San Francisco's Bowman stripped the ball from Kersey's hands immediately after making the reception. At the same time, 49ers defensive player Eric Reed tackled Kersey from his left-hand side. The tackle knocked Kersey into Bowman, whose legs were still splayed apart after having stripped the ball. Kersey rolled up onto Bowman's left leg while the left foot was still planted on the ground. Unfortunately for Bowman, his left knee was forced into valgus while it was in a flexed position. And that's a bad thing. This is a prototypical, and I mean prototypical, ACL killing mechanism. And although ACL injuries are typically caused by a non-contact mechanism, this mechanism represents the most common type of contact mechanism that causes or ends up in an ACL rupture. After the collision, Bowman fell to the ground in obvious pain, and ultimately he was taken off the field on a cart. He was initially reported to have suffered an anterior cruciate ligament and a medial collateral ligament injury to his left knee, or in other words, an ACL and an MCL injury of the left knee. However, subsequently, his fiance posted on social media that he had not only suffered an ACL and MCL injury, but that he had also suffered a PCL, or posterior cruciate ligament injury, of the left knee as well. And this just basically means that he had injured 3 of the 4 major ligaments of his left knee. Fortunately, Bowman had a great team behind him, and he underwent an ACL reconstruction that was performed by Dr. James Andrews a short time later. As the MCL is located outside of the knee joint, And Bowman's alignment is such that the MCL is relatively spared or protected from overt strain. His MCL was allowed to heal on its own rather than be repaired surgically. Bowman missed the entire 2014 season while rehabbing from his injury, but he returned to regular play in the 2015 season. The next injury that we're going to talk about involves one of the greatest receivers of all time, Jerry Rice. And this injury occurred during the 1997 season. Rice was injured in August of 1997 on only the opening day of the 49ers season that year. Rice was injured during the first quarter of the game when the 49ers attempted a reverse. After the ball had been snapped, Warren Sapp, the Tampa Bay defensive tackle who had penetrated the line, grabbed Rice from behind as he passed through the backfield. Sapp pulled Rice to the ground by his face mask, causing Rice's head to snap around to the right-hand side. This movement caused Rice to fall down awkwardly and to pivot backwards on his left leg. Rice remained on the ground for some time, grasping at his left leg, while Sapp was penalized for the rough play. Eventually, Rice was able to walk off the field with assistance, but he was unable to return to play in the game. A later MRI, or magnetic resonance imaging, revealed that Rice had suffered an injury to his ACL, MCL, and to his articular cartilage. And this just means that not only did he injure one of the cruciate ligaments within the knee, but that he also injured one of the collateral ligaments on the inside aspect of the knee, as well as cartilage on the inside. That's a bad combination. Eventually, Rice underwent a 2.5-hour ACL reconstruction at the hands of Dr. Michael Dillingham. His ACL was reconstructed using a bone, patellar tendon bone autograft. Now, for the record, there are a number of tissues that can be used to perform an ACL reconstruction that come from the patient themselves. The most common of these tissues include the hamstring tendon, the patellar tendon, and the quadricep tendon. Of those, the hamstring and the patellar tendon are the most common. However, in elite athletes, and especially professional football players, the bone patellar tendon bone construct is the autograft that is most typically used. And as stated previously, this is the type of graft that was used to reconstruct Jerry Rice's ACL. Rice, who was well known for being the most conditioned athlete in the NFL, rehabbed himself in an accelerated fashion after his surgery, and he returned to competitive football play after only 4 months of rehab. That's correct, I did say 4 months of rehab. That's absolutely ludicrous. And despite all odds against him, he returned to competitive play with the 49ers in December of the same season. After only 4 months. The same season in which he had previously torn his ACL only 4 months prior. In his first game after returning to play against the Denver Broncos, Rice was tackled after making a touchdown reception. Rice was hit by Broncos safety Steve Atwater. The tackle drove Rice's left knee into the ground, causing Rice to injure the knee, the same knee that he had just had reconstructed. But would you believe it? He did not suffer a re-injury of his anterior cruciate ligament. Instead, he suffered a patella fracture. He broke his patella. Both Rice and his coach felt that this injury was unrelated to his previous ACL reconstruction. However, it was most certainly and almost assuredly related to his ACL reconstruction, and more particularly, the technique that was used to repair the ACL. Patellar fracture after harvest of a bone patellar tendon bone graft is a rare but known complication that occurs in less than 1% of the cases. And unfortunately for Jerry Rice, he was in that 1%. When speaking about complications to my own patients, I tell them, even if the complication is less than 1%, if it happens to you, then it's 100%. And in this particular case, it happened to Jerry Rice. Rice underwent an open reduction and internal fixation of his patella using screw fixation. But unfortunately, he was unable to return to play that same season. Rice recovered fully in the offseason, returning to competitive play the next year and being named to his 12th Pro Bowl. That's right, that dude was a stud. The fourth injury that we're going to talk about is an injury that involved San Francisco running back Rahim Moore. This injury occurred in October of 2018 in a game versus the Oakland Raiders. Rahim was injured on a running play after receiving a handoff. While running through the line, he was tripped by a defender and started to fall towards the ground. While holding the ball in his left hand and covering the points, might I add, he placed his right arm out in front of him in order to break his fall with the ground. And unfortunately, his arm deformed as a result of the imparted force. He suddenly developed a second elbow in the middle of his forearm. Mostert suffered a both bones forearm fracture involving his right forearm. He underwent an open reduction and internal fixation of the both bones forearm fracture and was subsequently placed on the injured reserve list for the remainder of the season. And this just means that he had both bones fixed through 2 separate incisions on his forearm to access each of the bones individually. Each of those bones would have been fixed with a plate and screw fixation. Mostert recovered during the remainder of the season and he returned to the 49ers the subsequent year after signing a 3-year extension. So although these are not all of the injuries that have occurred to San Francisco 49ers players, these are some of the most memorable injuries that have occurred over the last 3 decades. If I've missed an injury that you thought was more memorable, or I've missed an injury that included one of your favorite players from the 49ers, be sure to let me know in the comment section down below. And if you're looking for information on workouts, exercises, or injury prevention, be sure to check out our sister channel, Human 2.0, on YouTube. Thanks for watching. You guys have been an amazing audience. And as always, that's been a word from Dr. Chris, not your everyday ortho.
The flesh wound.